some technical problems standing. Thank you. Hello once again. I am Fadela Shaib, speaking to you from WHO headquarters in Geneva, a very rainy city of Geneva today. You can even hear the beautiful and noisy sound of the rain on our roof. I welcome you to our global COVID-19 press conference today, Friday, 23rd October. As always, we have in the room Dr. Tedros, Director General of WHO. He's joined by Dr. Mike Ryan, Executive Director, Health Emergencies, Dr. Maria von Kerkhoff, Technical Lead, COVID-19, and Dr. Janet Diaz, Lead on Clinical Care Response COVID-19. In the room also we have Dr. Soumya Swaminathan, Chief Scientist, and remotely joining us, Dr. Maria Angela Simao, Assistant Director General, Access to Medicines and Health Products. Now, without further delay, I would like to hand over to the Director General of WHO, Dr. Tedros, for his opening remarks. DG, you have the floor.
Thank you. Thank you, Fadila. Good morning, good afternoon, and good evening. We are at a critical juncture in this pandemic, particularly in the Northern Hemisphere. The next few months are going to be very tough, and some countries are on a dangerous track. Too many countries are seeing an exponential increase in cases, and that's now leading to hospitals and ICU running close or above capacity, and we're still only in October. We urge leaders to take immediate action to prevent further unnecessary deaths, essential health services from collapsing, and schools shutting again. As I said it in February, and I'm repeating it today, this is not a drill. We're calling on governments to carry out 5 key actions today. First, assess the current outbreak situation in your country based on the latest data you have at hand. Conduct honest analysis and consider the good, the bad, and the ugly. I have a specific message for those countries that have successfully brought COVID-19 transmission under control. Now is the time to double down to keep transmission at a low level. Be vigilant, be ready to identify cases and clusters and take quick action. Do not allow the virus to take hold again. Second, for those countries where cases, hospitalizations, and ICU rates are rising, make the necessary adjustments and course correct as quickly as possible. Making changes when needed shows leadership and strength. Third, it's important to be clear and honest with the public about the status of the pandemic in your country and what's needed from every citizen to get through this pandemic together. Fourth, put systems in place to make it easier for citizens to comply with the measures that are advised. This means if people are told to isolate or quarantine or businesses have to close temporarily, governments need to do everything they can to assist individuals, families, and businesses. Fifth, the next few months for many people will be difficult. There are incredible stories of hope and resilience of people and businesses responding creatively to the outbreak, and we need to share this widely. Governments need to carry out the basic steps of speaking to people who are infected with the virus and their contacts and giving them specific instructions on what to do next. If governments are able to hone their contact tracing systems and focus on isolating all cases and quarantining contacts, then mandatory stay-at-home orders for everyone can be avoided. We have seen many times from around the world that it's never too late for leaders to act and turn the outbreak around. Key to a united front against the virus is sharing resources equitably. Oxygen is one of the most essential medicines for saving patients with Covid-19 and many other conditions. Many countries simply do not have enough oxygen available to assist sick patients as they struggle to breathe. I'm going to talk to you about what WHO and partners are doing to fill the global oxygen gap. Estimates suggest that some of the poorest countries may have just 5 to 20% of the oxygen that they need for patient care. Through the pandemic, the demand for oxygen has grown exponentially. Back in June, when there were approximately 140,000 new COVID-19 cases a day, the global need for oxygen was estimated to be approximately 88,000 large cylinders each day across the world. As daily cases rise around the world to over 400,000, the need for oxygen has gone up to 1.2 million cylinders each year, just in low and middle income countries alone, which is 13 times higher. Early in the pandemic, WHO's approach was to scale up oxygen in the most vulnerable countries by procuring and distributing oxygen concentrators. This led to over 30,000 concentrators, 40,000 pulse oximeters, and patient monitors to reach 121 countries, including 37 that are classified as fragile. This includes installing pressure swing adsorption plants, or PSS, that would be able to cover the supply needed for a large hospital and district health facilities in the area. Somalia, Chad, and South Sudan had to rely exclusively on oxygen cylinders from private vendors that are often traveling long distances and come with a high price tag. WHO is working with the ministries of health in these 3 countries to design oxygen plants fit for their local needs, which will result in sustainable and self-sufficient oxygen supply. WHO is committed to working in solidarity with all governments, partners, and the private sector to scale up sustainable oxygen supply. The Oxygen Project reflects WHO's commitment to end-to-end solutions and innovation to do what we do better, cheaper, and reach more people. For example, we're working with partners to harness solar power to run oxygen concentrators in remote places where electricity supply is unreliable and to reduce costs. One of the main barriers to medical oxygen is the high transport costs of cylinders to the health facilities. In Kenya, a private sector company has positioned oxygen plants near clusters of health facilities and uses a milk delivery system to deliver oxygen to more than 140 clinics. Incentivizing the business sector to change its approach and model is key to ensuring sustainable oxygen in low and middle income countries. Asante sana, Kenya. And to be successful, the health workforce needs to be ready. Not only doctors and nurses with experience in caring for severely ill patients, but also biomedical engineers, respiratory therapists, and maintenance staff. Oxygen saves lives of patients with COVID-19, but it will also save some of the 800,000 children under 5 that die every year of pneumonia and improve the overall safety of surgery. A better world means ensuring oxygen is available for all. where they need it and when they need it. Tomorrow marks World Polio Day week, and partners around the world, led in particular by Rotary International, are organizing events and raising awareness about the need to eradicate polio. Over the summer, the world collectively welcomed Africa's historic success of ridding the continent of wild polio virus. Thanks to hundreds of thousands of health workers reaching millions of children with safe and effective vaccines across the continent, the world celebrated one of the greatest public health achievements of all time. However, while there is polio anywhere, the world remains at risk of resurgence. Following suspension of polio and routine immunization due to the pandemic, vaccination drives have now been restarted. We applaud and encourage governments for doing catch-up campaigns so that no child is left behind, and we can soon consign polio to the history books alongside smallpox. Smallpox eradication, as you know, is a remarkable achievement, not least because it was completed at the heart of the Cold War. Health did then and should now always come above politics. And it's with sadness that this week we lost one of the great titans of smallpox eradication with the passing of Dr. Mike Lane. Dr. Mike Lane spent 13 years chasing down the last remnants of smallpox, finding cases and vaccinating communities in some of the remotest corners of the earth, where smallpox was still endemic. At CDC, Dr. Lane was the last program director of the smallpox eradication program and received many awards, including the U.S. Public Health Services Commendation Medal. For many years, Dr. Lane was an advisor to WHO on smallpox. I wish to express my deepest sympathy to Dr. Lane's friends and family. We will continue to honor his legacy. Finally, telling stories is as old as human civilization. It helps us understand our problems and can inspire action that changes lives. WHO is proud to announce the second Health for All Film Festival to cultivate visual storytelling about public health. Submissions are open for tomorrow to 30th January 2021. We look forward to receiving original short films from across the world. More details are available on our website. I thank you.
Thank you, Dr. Tedros. I would like just to remind journalists that we have simultaneous interpretation. It's provided in the 6 official UN languages plus Portuguese and Hindi. We will now open the floor to questions from journalists. I remind you that you will need to raise your hand, use the raise your hand function in order to get in the queue to ask your question. I will start by inviting Carmen Pone from Politico to ask the first question. Carmen, can you hear me?
Yes, Fadela, thank you so much for giving me the floor. I have a question about remdesivir. The FDA announced that they are giving a full approval to it yesterday. And given what we were discussing last time about the solidarity trial results from remdesivir, people may be confused with the two developments. So I wanted to ask, I assume Dr. Soumya Swaminathan, what does this mean? What normal people, that are not following these developments very closely should know about these two separate developments, the solidarity trial results and the FDA announcing full approval for the medicine. And also last time you were mentioning about the guidelines that are still being developed by the WHO group specifically designed to that. Can you give us a timeline on when you expect them to release their recommendation about remdesivir use or not? Thank you so much.
Thank you, Carmen. Dr. Swaminathan will answer this question.
Thank you, Carmen, for that question. And you've raised an important issue, but let me start by saying that the Solidarity trial is a randomized clinical trial that was looking at 4 different drugs that were considered to be promising early in the pandemic in February, March. These were all repurposed drugs. And when we presented the results, it was a trial results. Now, the trial results are used both by guideline developers as well as by regulators to make decisions about how and when and where best to use these drugs. So the guideline development process in WHO is a distinct, separate process that has begun, and Dr. Janet Diaz is here. She may say more about that and the timelines later. The regulatory approvals are yet another set of processes, and regulators look at data that companies provide to them on efficacy and safety, and of course on the manufacturing processes as well before they give approval. And there are different types of approval. As we know, remdesivir was given an emergency use authorization a few months ago, and that's done in the case of an emergency in a pandemic, for example. It's based on very preliminary data, and it's essentially a temporary measure while more data is being accumulated. So what we understand from the FDA decision yesterday was based on data submitted to them from Gilead, which did not include the Solidarity trial results. We have submitted the Solidarity trial results to Gilead. They first saw the results on the 23rd of September and then saw the full manuscript on the 28th of September. So they did have the results even before they were made public through medRxiv, because we give it to them 10 days in advance. So it appears that the Solidarity results were not considered, were not provided to the FDA. We believe that it is the largest trial in the world globally. 5,000 patients were randomized to either remdesivir or standard of care. We looked at very important endpoints, in-hospital mortality, no difference. Progression to ventilation, so people who came in, 92% of people who entered this trial, were randomized to this trial, were not on mechanical ventilation. So they were either not on oxygen at all or they were receiving oxygen. So we looked at how many of those progressed to need ventilation, exactly similar numbers in the remdesivir and the control arm, and same for the other drugs that we tested. And then we also looked at proportion of patients who got discharged at the end of 7 days of hospitalization. And we found that when we compared remdesivir with some of the other drugs like hydroxychloroquine or lopinavir, there was no difference in that proportion compared to standard of care. One of the criticisms that we've seen is that this was not a placebo-controlled trial and that it was not double-blind, which means the investigators and the participants were not blinded to the arm. And we believe that our trial is still very robust because we looked at endpoints like mortality, like death. It's not a soft endpoint. You cannot fudge that endpoint. We looked at progression to ventilation, which is, again, very objective. So on the other hand, the NIH trial, the ACTT trial, looked at time to recovery, and recovery was defined in a number of ways, but it was based on how patients were feeling and whether they needed oxygen and so on, whether they needed hospitalization. And all the other elements of the trial, like the good clinical practices, the way the randomization was done, the way the data was monitored and put together, the way it was analyzed, done to the highest standards. So we believe that our results are very robust, and we hope that people who are doing treatment guidelines in other countries as well as regulators around the world will take note of our study results in addition to the other evidence, because you need to look at the global evidence for a drug before you make decisions. And we should have the paper published fairly soon. So I'm not sure if Anna Maria wants to add to that, or Janet probably on the process of treatment guidelines, which is something we're working on.
Thank you, Samia. So WHO has a very well-developed approach to developing guidelines and treatment recommendations. What we're doing now in the pandemic is to try to continue with that approach in a transparent and trustworthy way, but do it faster and do it more quickly. So since the resulting of the Solidarity trial, we would anticipate that the guideline would be available within 3 to 4 weeks. And I have to acknowledge that that is a fast process for guideline development because there are many steps that have to be taken in order to develop that guideline. So that's already in process. We have convened our independent guideline development group panel. And that panel is, has already been convening, and they will convene next week to look at the totality of the evidence. And as Samia already said, what we are looking at is not just one trial result, but we are looking at all the trials on the specific interventions and looking at it in totality and then grading the evidence and trying to figure out the certainty, what we believe, how much we believe the results in the evidence. And that is done in a very systematic fashion. And so that meeting will happen next week, and we anticipate after that meeting about 1 or 2 weeks more until the final guideline is published. So that is the timeline and that is the process that we are on. So thank you.
Can I just add for those out there in the general public, because I think part of the question was how can people understand this out there? One authority says one thing, another authority says another thing. The primary function of a regulatory authority at national level is to ensure that safe products are put on the shelf and that they have certain indications and certain levels of proven efficacy or indicative efficacy. And in that sense, the regulatory process of EMA or FDA basically is a signal for what can go on the shelf. What clinicians ultimately used is based on complex clinical guidance for the day-to-day practice of diagnosis and treating a patient. So therefore, it is the clinical guidance package that's most important in guiding physicians to use what's on the shelf. And in that sense, regulatory authorities may place items on an approved list. That doesn't necessarily mean that they will be used in any particular practice unless they pass into clinical guidance that's given to doctors and nurses through these kinds of processes. There's no inherent conflict between these two processes. They're in some senses mirror processes, and they should be mutually complementary, and they certainly should be consistency. But when you see differences between them, it doesn't mean that something's wrong. It just means we need to get on now and develop the clinical guidance using all of the available information so we can give the best possible templates to our member states to make good decisions for clinical practice.
Thank you all. I would like now to invite Jamil Chad to ask the next question. Jamil, can you hear me?
Yes. Can you hear me, Fadela?
Yeah, very well. Go ahead, Jamil.
Thank you very much. Mr. Tedros, President Bolsonaro refused to buy Chinese vaccines. Is there any scientific reason for this? And secondly, if I may, some other cities in Brazil seeing, as Mike Ryan said in the last couple of weeks, a reduction of cases, or at least a stabilization in some of these cases. Is there a threat of a second wave as in Europe, or this is a very specific situation just for Europe, and those in other places of the world can simply relax, let's say like this?
Thank you, Jamil. Dr. Ryan will take the second part of your question. Thank you.
Thanks. I'll answer the second part. I think the Director General was quite clear in his opening statement. The first thing he said was each country needs to look at their individual situation. No country is out of the woods, and what we've learned, certainly in the Northern Hemisphere, is that second waves are not only possible but highly likely anywhere in the world. Those that have been hit hard the first time round can get hit hard a second time round, and those that were hit hard and hit a glancing blow in the first time round can get hit a harder blow in the second. So there's no predicting what your circumstances will be. So the only way you're going to get at that is to clearly understand, and in places like Brazil, understanding now the true trajectory of the virus, the seroepidemiology of the virus in the population across different population groups, and then to learn the lessons of follow-through. Countries have got to low levels of disease and then not necessarily followed through on the testing, on the tracing, on the isolation, on the community support, on the measures to reduce transmission. and are seeing disease creep back in and in some cases exponentially rise. So for countries like Brazil, where there are very strong scientific and public health infrastructure, it is time to step back, continue to drive the curve downwards, continue to work hard at that, and to ensure that everybody follows through to ensure that if a second wave does arrive, those key structures, the health system, the community empowerment, the governance and coordination mechanisms, and the public health surveillance, isolation and quarantine capacities are in better shape than they may have been in previous waves. Those countries who learn in the first wave do better in the second. I think that can be assumed. With regard to your question on vaccines, again, it is the sovereign decision of our member states to decide where they buy and who they buy vaccines for. WHO has a pre-qualification process, and we're entering into that, and there have been expressions of interest issued already for potential candidates that may be approved by WHO at some point in the future. Our vaccine policy is defined, or the Director General is advised by the Advisory Group on Immunisation, SAGE, and they have already developed outline policy advice. The COVAX facility, working with all of the partners, is putting together a massive global partnership to ensure fair and equitable distribution of the vaccine. But ultimately, despite all of those measures, it is still the sovereign right and responsibility of governments to ensure that they have the right vaccine policies in place, that they cooperate internationally, and we will leave it to the government of Brazil at the federal and state level to work out what the best path is for the people of Brazil.
Can I just add to that? Just very quickly to add to what Mike said, that the COVAX facility exactly provides an opportunity for all countries to ensure that the best chances of getting a highly effective and the most effective and safe vaccine at an affordable price, because we're pooling risk. So we're distributing the risk of investing across multiple vaccine candidates, so you have a better chance of success. And we're also going to pool procurement. And currently, the COVAX facility is catering to 184 countries, collectively representing 90% of the world's population. So, and Brazil is part of that as well. So I think that that's probably the best thing for countries to do, is to be part of the COVAX. It shows global solidarity, but it also gives you the best chances of getting a vaccine that's safe and effective in the shortest possible time. Thanks.
I think Dr. von Kerkhove would like to add something.
Yeah, thank you. I want to reinforce some of the things that the Director General has said and Mike has said about the countries that are reducing transmission and countries that have transmission low. This virus and the circulation of this virus is not even all over the world. And I think that's really, really important, because many countries are in a very dangerous situation, but many other countries are actually in a very good position. They've brought transmission down to a very low level. They're opening up their societies. But the message that we have, and we cannot say this stronger, is to keep it up. And in fact, I would say even scale up. So the systems that you have in place to keep yourself at the ready, to remain vigilant, to quickly identify any cases that are there, and really carry out the case finding, isolation of the cases adequately in appropriate medical care, to carry out the contact tracing. And what we mean by that is, for every case that is identified, every cluster that is identified, carry out a cluster investigation. Look for all of those individuals who had contact with a known case. Contact them, personally contact them, use the systems that are in place to find them, put them into quarantine. And by doing so, making sure you follow them, put them away from other people in terms of the quarantine, and support them through that quarantine period, you will continue to break chains of transmission. And I think making sure that those systems are in place and using the systems that you've worked so hard to put in place will ensure that transmission can remain low. It is not the time to let your guard down. It is not the time to close any systems that are in place. Make sure your testing is still happening. Make sure you have your systems that are working and your workforce is supported. So I think we just want to really emphasize that it is not the time to let your guard down, because you can keep transmission low.
So why not I give, thank you. No, it has been said, but just a few seconds. One, as the journalist said, Jamil, the number of cases and deaths is on the decline. And we're happy that it's on the decline. But at the same time, as Mike and Maria said, Brazil should not let its guards down. So it should really continue with the momentum. We're glad that it's declining, so it should keep that momentum. And second, on the vaccines, the only thing we advise is that as long as it's safe and effective, it's up to Brazil to choose whatever vaccines it wants. Thank you.
Thank you, DG. Let's move now to Spain. Natalia Segura from Catalan News Agency. Natalia, can you hear me?
Hello, I can hear you. Can you hear me?
Yes, very well. Go ahead, please, Natalia.
Okay, I wanted to ask two questions. First of all, I wanted to know if you're worried about the increase of cases in Europe. I don't know if you could make an assessment of the current situation and if you think that Europe is at risk of a second lockdown. And secondly, I also wanted to ask on the development of vaccines, if you have any new forecasts on like if it is still possible to have a vaccine to prove effective and secure by the end of this year, and if not, when that could happen. Thank you.
Yeah, for your first question, Dr. Van Kerkhove will answer it.
Yeah, so the first question around the worry in Europe, absolutely. I think, you know, as the Director General has pointed out, we've been pointing out over the last few weeks, as our regional director in Europe has pointed out, there is a very worrying situation that is happening in Europe, where we're not only seeing increases in case numbers, but we're seeing increases in hospitalization, and we're seeing increases in the rate of individuals who are needing intensive care. And in many cities across Europe, the capacity for ICU is going to be reached in the coming weeks. And that's a worrying situation as we are in October. We're in the autumn in the Northern Hemisphere. The influenza season is just about to begin. And so the demand for testing for people with respiratory diseases will increase. The demand for hospital needs for people who are sick will increase. And so we're in a worrying situation. And in fact, in the last 24 hours, we've had almost 445,000 cases reported. Almost half of those are from Europe. And so while we're in a different situation now where we can test more, we can carry out more surveillance, the worry that we have are the numbers of individuals who are requiring hospitalization. And I think what the Director General pointed out in his speech today is what we need all countries to do, particularly those that are in a dangerous situation, particularly those that are in Europe and in North America. And I will repeat them because I think they are worth repeating. We need all countries to carry out an honest assessment of the situation that they have right now with all of the data that they are collecting. Again, we're not in the same situation we were in March and in April. There are systems in place that are capturing information about where is transmission occurring, who is infected, what is the age profile, are there certain clusters that are happening in particular types of settings. Do an honest assessment of that and then look at the system that you have and the strategy and the plans and the actions that you have in place. Do any corrections, course corrections need to be made. And the Director General said it himself, course corrections are not weaknesses. These are actually looking at the systems you have in place and making those necessary changes to reach your goal. And that goal is to reduce transmission and save lives and save livelihoods. Really, next is to talk to the populations and say, here is the situation that we're in. This is what it's going to look like in the next few months. And some of those discussions are going to be more challenging than others. And I think everyone as individuals needs to understand that they have a role to play and do what you can as an individual right now to contribute to reducing transmission. Some of this will require some sacrifices that you will need to make as individuals and as families, but the sacrifices that you make as individuals will help others who can't make those same sacrifices, who need to go into work to carry out those essential services that keep food on our table and keep us cared for in hospitals. We also need governments to support people to carry out those necessary actions. If people are asked to stay home, if businesses are asked to reduce hours or partially close, how can we support those businesses so that they don't go out of business? How do we make sure that families can continue to telework, et cetera? And lastly, to really share messages of hope. Mike and I did a Facebook Live this week where we talked about hope, we talked about resilience, and I think many people across the world are scared right now, and we need to share the stories of how we are getting through this together. So just please remember that many countries are getting through this. Many countries have shown us the way that they are getting through this. We can learn from them, we can listen to them. They're in solidarity with us as well. And we will get through this. But do what you can as individuals and as your families can do to really support us getting through this period.
Fidel, just on that point before Sumia comes in, because I think also within this, while Europe is experiencing, a very large rise in the number of cases, we also, and we do see increases in hospitalizations and a tracking upwards of fatalities. We also need to make our best efforts to ensure we keep that fatality rate low. And let me give you some numbers to compare. If we go back to March, April, May, in our European region, we were seeing about 40 to 50,000 cases per day with almost 5,000 deaths per day. It was really, really bad from that perspective. We are seeing now anything up to 150,000, 160, 170, up to nearly 200,000 cases a week, sorry. That was the weekly number before, and we're seeing, about 2.5 or 2 to 2.5 thousand deaths or below that. So, and I'm not saying that those deaths won't catch up. They can, and they are catching up, but there's still a lot of lives to be saved here. So, while the numbers are extremely high, we are lucky that the deaths have not immediately tracked that. So, supporting our frontline workers in Europe, ensuring they have the right equipment, there's enough of them, that they're rested, that they're able to work, that the system remains efficient and calm, and that we're able to prioritise the clinical pathway for people through that system, that people are getting into early care, and we're prioritising care for those with vulnerable, will save lives. We don't have to see deaths absolutely track back to the horrific levels they were as a proportion of all cases in springtime. Things have changed. We're better. We're better now. So yes, we need to prevent transmission, but we also need to focus on reducing the death toll, which will rise in the coming days, I have no doubt. But we need to also put some investment, more investment, into ensuring that our frontline system does not collapse in the face of an ever-increasing caseload of very sick patients. Sorry, Sumi, I cut across your...
No, I think that's very important, Mike. So on the vaccines, as you know, we've been tracking it. We continue to track the progress. There's good progress in terms of the number of clinical trials that are starting up and moving ahead from phase 1 and 2 into phase 3. So currently we have 10 trials in phase 3. A couple more candidates are likely to move from phase 2 to phase 3 in the next month or two. Our best expectations, as far as we know by watching the trials that are moving ahead, is that we may have results from 1 or 2 of the vaccine trials before the end of the year, possibly starting late November. And this is going to be just the bare minimum, the results that have been are considered by regulators to be eligible to be at least looked at for an emergency use authorization. So it's data on efficacy and limited data on safety. Now, based on this, regulators will have to look at the data and decide what they're going to do with it, and so will WHOs. As you know, we have criteria that we've put out, bare minimum criteria for an emergency use authorization, and also there's an expression of interest for companies to submit their dossiers and their data to WHO on an ongoing basis so that we can keep up with the progress of the trials. So from the submission of data, it takes a few weeks for regulators to look at it, or for WHO to look at it for that matter. So we might, early in 2021 is when we are likely to see some decisions being made. And again, we cannot guess before we see the results as to which and how many of those vaccines will actually prove to have efficacy and safety data which are above the benchmarks which we've already set. But certainly early in 2021, I think, is when we're going to start seeing more and more results coming out. And so somewhere in the first quarter of 2021, we're talking about the world, that there may be some vaccines available for the most high-risk groups in countries across the world. And as we've said before, we are focused on a fair and equitable distribution of vaccines. So if there's limited supplies of vaccine in the beginning, which that's going to be the reality, we'd like to see that fairly distributed so that the highest risk people, the health workers, the frontline workers, have access to the vaccine regardless of which country and where they live in the world. We also need to balance expectations because we know that the success rates of vaccine trials is 10 to 20%. And the good thing is that there are many candidates in trial. There are going to be successes. There may also be failures, and we have to be prepared to accept both. Thanks.
Thank you, Dr. Swaminathan. The next question goes to Stephanie Nebehe from Reuters. Stephanie, can you hear me?
Yes, thank you. A question, please, regarding the concerns or controversy in South Korea following deaths after influenza vaccines, which may or may not be related. Are you in touch with Korean authorities? Does WHO have concerns about this, and do you see it happening anywhere else? Thank you.
So, Stephanie, thanks for the question. Sorry, Fadela. Thanks for the question. Yes, we are in touch with colleagues from Korea. And what we understand so far, and I'm looking at my notes here, more than 13 million people have been vaccinated in Korea this year for influenza. And we understand that there have been 28 deaths that were reported following flu vaccine between the 19th of October and the 23rd of October. And the Korean health authorities are looking into these deaths. They've said in a preliminary investigation into the 6 deaths, they didn't find any direct link with the vaccines and that there were no toxic substances uncovered. But we are in very close contact with Korea and looking at them. And as with all vaccines, there's active monitoring and follow-up of all of those who received their immunization. And we will continue to work with our colleagues in Wipro and in Korea to provide more information as it becomes available.
Thank you. I would like now to invite Larry Mullin from National Geographic to ask the next question. Larry, can you hear me?
Hi, yes. Can you hear me as well?
Yes, very well. Go ahead.
Thank you. We've heard that WHO is finalizing its plans for the mission to find the coronavirus's potential animal origins in China. If so, what specifics can you tell us about what the investigation would look like, including the type and number of experts who would participate, technology and tools they might use, methods they might use, and so on? And also, I wanted to ask, if that's taking place, what do you expect to find, considering that it's been nearly a year since the pandemic began, and there are reports that the Wuhan market, where the pandemic potentially began, might have been cleared out or closed?
So thanks for the question. I can begin. So what I can say is that progress is being made on the plans for the mission. As you know, we had a team that went to China, a pre-team from WHO, to establish the terms of reference and to set the plans in motion for an international team and to carry out further studies to evaluate the origin of the SARS-CoV-2 virus. The terms of reference were agreed over the summer, and they include a number of different types of studies that need to be done. Studies that will begin in China, because in any emerging outbreak, any start of a outbreak that is zoonotic, of a zoonotic pathogen, it means there's a jump between animals and humans, you need to start at the source. And that source was the first cases were detected in Wuhan, China in December. And so the early studies will begin there. And then the next phase of the studies will be developed as the evidence and the results from those first phase studies become available. So that we will follow the science and follow the necessary steps that need to be taken there. So the progress is being made. We've reached out to the team, the international team, and so we will be able to share more in the coming days.
Yeah, and we certainly have had a pre-briefing with the international team members, and they do represent a very broad range of scientific skills, and each and every one of them is leaders are leaders in their own fields, and they represent a broad geographic and base of expertise as well. We expect, and we're making great progress with our counterparts in China, and we expect to have a meeting of the two teams, virtual meeting of the two teams together before the end of the month. And as Maria said, we have a two-phase strategy. Some of the studies in phase 1 have already begun because they're local studies that need to be carried out, and what we will hope is that preliminary information on those studies will be shared between the two teams, the virtual teams, and the idea will be that the teams will work together virtually. They will explore the results that are currently available. Based on that, they will redefine those priorities for field missions, and then we hope to see a team deploy to both look at continuation of phase 1 studies and also plan and design the implementation of phase 2. We thank all those experts who have agreed to participate and to support this process, and obviously, and that's both in terms of Chinese and international scientists, and we look forward to working with our member state in ensuring the best possible studies that can be carried out. The group will also look at the broader context. As you've seen, going back to February, WHO recognized the need for the animal-human investigations. This has always been part of our DNA in terms of looking at everything from MERS to SARS to Ebola, many other diseases in the past. Sumia and myself and others convened a meeting in February, the research and development meeting that was carried out then, and as part of that roadmap, a very extensive set of research targets were laid out. Clearly, as a result, and we very much welcomed the resolution of the World Health Assembly, WHA 73.1, which also highlighted the need for accelerated animal-human studies. And on the basis of that and our previous work and plans under the R&D blueprint, we've been working with all parties to put together the necessary studies to better understand the origins of this virus. So I believe we are making good progress. Please bear with us as we continue on this journey of discovery and knowledge. And I am sure we will be organising, I hope, as this thing moves forward, more regular briefings, particularly with those science journalists who follow this closely, to ensure that we keep you well informed of the scientific developments. And we do trust that this process can remain a scientific collaboration aimed at discovering knowledge that we will need to prevent this disease happening again, and that is the basis and spirit in which all enter the process.
Thank you. I would like now to invite Adrian Aguirre from SUMEDICO. I believe he's based in Mexico, to ask the next question. Please don't forget to unmute yourself. Adrian, can you hear me?
Hola, hello.
Hello. I'm Adrian Aguirre, and I'm a journalist at somedico.com. And I have two questions. One is, what is your opinion on the situation in Mexico? And secondly, the people in this nation aren't always following the rules. They have a habit of not following the rules, and there are still people who believe that the pandemic isn't real. What advice could you give the government to make people aware of the reality of the pandemic? Thank you.
Thank you, Adrian. I would really like journalists to ask only one question to allow for more participants. I would like to invite Dr. von Kerkhoff to take the first part of your question.
I'm actually going to take the second part of the question, Fadela. So the question on the people complying with measures and the pandemic real, we can assure you that the pandemic is very real. But I think the question that you asked about compliance is a good one, because I think there's different reasons why people don't comply or can't comply. And I think this is not an answer specifically to Mexico, but I think globally, there are many individuals who are, taking steps and doing the things that they need to do as individual measures, which include the hand hygiene, carrying your alcohol-based gel, practicing your respiratory etiquette, wearing a mask where you are asked, staying home if you are asked, making sure that you, follow the local guidance that is being put in place. But there also needs to be an enabling situation that individuals can comply. Because in many parts of the world, and again, this is not Mexico specific, but in many parts of the world, individuals need to leave their home to be able to buy food, to be able to go to work, to ensure that they receive a salary so that heat can be in their home and that they could feed their children. And so there are a number of reasons why individuals may not be able to comply. And I think in those situations, it's really important that communities and governments and religious leaders and other leaders figure out how we can support individuals, families, communities to comply with the measures that are needed. And the other thing, on the other side, there are many individuals who I know, that may not want to comply because it's difficult, it's inconvenient. But I think what we need globally is this collective unity to come together and see what it is that I can do within my power to be able to take control of the situation. What is it that I can do that could reduce the opportunity for the virus to reach me and my family, to reduce that exposure so that I don't get infected and that I don't pass the virus on to other people? And in some situations, it means, not having people over to your house. It means, that you aren't able to go out to eat. Maybe you can buy food and have it delivered to your home so that you could support local businesses. It may mean not having that birthday party for your kids, which is something that I will have to do for my little boy this year, and just have it a different way. So I think there are different situations, and it's very hard to give a global answer to something like that, because there are some situations where people cannot comply, and we need governments and others to support individuals to be able to carry out those actions. But in other situations, all of us have a collective responsibility to do what we can. So please, if you can, when you can, where you can, do what you can to be part of this global fight.
Just on Mexico specifically, Mexico has plateaued at a relatively high number of cases. I mean, Mexico's having about 35,000 cases a week, 2,500 deaths per week, total of over 860,000 cases and nearly 87,000 deaths overall. So Mexico has been one of the most affected countries in the Americas and has suffered with many countries in Central South America and in many other parts of the world. The disease has plateaued, has taken a little jump in the last couple of weeks, but some of that was due to changes in reporting requirements. But stability is good. It's better than exponential rise as we're seeing elsewhere. But as Maria said earlier, now is the time for everyone to consider how you're going to push that curve down. We've seen parts of Mexico increasing in the numbers, other parts decreasing, and now the need is to get the whole of the country moving towards much lower numbers and then to follow through on that. Mexico's been through a tough time. The health workers in Mexico have been through a tough time. Mexico has done some very good things. It's been very good at tracking infections in pregnant women, for example, and looking at some high-risk groups. It's also been very flexible in its epidemiologic definitions and been willing to really look at epidemiologic confirmation of cases where testing wasn't available. So Mexico's shown an openness to really trying to measure the problem, despite absence or lack of testing at times. So I think, again, going back to what the Director General said in his first 5 points, every country needs to step back and look at where you are now. If you're plateauing, you need to find a way to get down to the next level on the mountain. And then when you're down there, you get to the next level down. If you're increasing exponentially, you need to find a way to blunt that. You need to try and crush that, or you're heading very much in the wrong direction. Everyone has work to do. Those who are down and doing well need to avoid slipping back into high levels of transmission. Those on the way up need to find a way to get off that escalator, because that is not going anywhere good for your health system.
Thank you. I would like now to invite our next journalist from Greece, Kostas Davanis. from ERT. Kostas, can you hear me? Can you unmute
do you hear
yourself?
me? Thank you, Adela.
Yes.
Thanks for taking my question. I'm wondering, we are talking now for a long time about vaccines and treatments. We need urgently to finally defeat our invisible enemy, the coronavirus. But we are not talking about other means of precaution except for masks, hand washing, and keeping distance. So my question is there another way to prevent a coronavirus infection with our knowledge today, 10 months after the first case? According to a study by a German university a few days ago, it seems that inorganic polyphosphates can naturally prevent the coronavirus from entering through the mucosa into the lung cells by creating a natural barrier in the mouth and the nose. Thank you.
Thank you for the question. Yes, there are many things that individuals can do to protect themselves and protect their families. And so while the entire world has come together in incredible global solidarity and scientific pursuits to find therapeutics, to advance the development of therapeutics for people with COVID-19, and to develop safe and effective vaccines, and to ensure that there will be equitable access to this globally, there are many things that we could do right now. There are three things to focus on. First of all is what we need to do to prevent infections, to reduce transmission. The second area is to save as many lives as we can. So prevent those that have been infected to developing severe disease and prevent those from dying. And the third is to ensure that we have engaged and empowered and informed populations and people so that everybody knows what they can do to protect themselves. So a lot of this is very low tech. So one of the things that everyone can do right now is physical distancing. So at least 1 meter apart, make sure that you remain physically distant from others outside of your immediate family, but still remain socially connected. So make sure that you still have that social connection with individuals. You can avoid crowded spaces. So there are situations in which transmission can be amplified, meaning that it could spread more easily. And these tend to be in situations where people are in close quarters with one another. They spend prolonged periods of time indoors with poor ventilation. You can avoid those situations as much as you can, and if not, you can wear a mask. You can open the window to ensure that you have natural ventilation coming in or fresh air if you live in a location that has fresh air to fill that space. Hand hygiene. Make sure it's incredibly simple, but not in all parts of the world. WHO is working with partners to ensure that we have access to water and soap and hand washing stations, access to alcohol-based rub that you can use. Because if the virus is on your hands, if you wash your hands or use an alcohol-based rub, you can kill the virus, you can inactivate the virus and not infect yourself. One of the most important things that you can do every day is be informed. Know where the virus is in the area that you live. As we keep saying, the virus is not spread evenly all over the world. And in many countries, they have successfully controlled transmission, and those societies are opening up. And they can go about their daily life in a very different way than in some countries that are seeing really intense transmission. So know your local situation and follow that regularly. Find out good quality sources of information so that you know what is your risk. When I leave my house, if I can leave my house, what is my risk? And take decisions that reduce your risk. It also means taking some sacrifice, making some sacrifices of avoiding some gatherings that you may want to have. And again, I say I'm in the same situation, we're in the same situation here. But all of those things are actions that reduce the amount of exposure that you would have, and it reduces the risk of infection. And that's really important before we have those therapeutics and vaccines that are underway. There are a lot of therapeutics that are in development. We have dexamethasone, which is for severe and critical patients. And so that is something that is also happening in parallel. But the other thing that you need to know is making sure, as an individual and for my family, what I need to be able to do to know if the virus is around me, how can I get tested if I need to get tested, and how can I keep my family safe. Last thing. If you have been asked, if you are a case, and you please contact your authorities if they don't contact you and say, what do I need to do? If you are infected with the SARS-CoV-2 virus, you need to be isolated. Ideally, isolation would take place in a medical facility. And of course, if you need medical care, seek that medical care immediately. Contact your healthcare provider. In some situations, isolation for infected individuals can take place safely at home. But you need to make sure if you are in isolation at home, you keep yourself separate from your other family members. If you are a contact of a known case, you need to be in quarantine. And quarantine means that, again, contact your authorities to find out what that means in your area. If quarantine needs to take place in a specialized facility where you are cared for and looked after, or you are in quarantine at home. But again, if you're in quarantine at home, that means that you don't go to work, it means that you don't go to the grocery store, you need to remain separated from other individuals. Those actions break chains of transmission. That's very difficult to do, and you need to be supported in doing that. But I just wanted to highlight that those are things that everyone can contribute to breaking these chains of transmission.
May I just add that we're constantly scanning the landscape of research for any possible therapies, preventive, therapeutic, and others, and Anna Maria, the R&D Blueprint team, Sumia, and many other scientists in-house in the various clinical networks, where I'm not specifically aware of the agents that you refer to, but we are constantly looking and receiving direct inputs many times from clinicians, developers, companies, and others, and every single potential product gets looked at to see if there is potential for that. Anna Maria may wish to comment on that. But also, going forward on what Maria said, and while we have Janet with us, and what I said about the fact in countries now at exponential growth, yes, we have to try and push down the disease, but we have that, unfortunately, that kinetic energy that this virus has in many countries right now. And that's going to result in a lot more people arriving in hospital and a lot more people needing really, really good care. Janet and her team is not just the people in Geneva, it's the people in our regional offices, our country offices, and the hundreds and hundreds of clinicians and doctors and nurses, engineers, architects, biomedical engineers, logisticians who are working around the world on end-to-end solutions, on building clinical pathways. Today, we started the process of releasing 7 new clinical training courses on openwho.org. 500 doctors and nurses around the world have contributed to the development of those courses. That's reaching millions of frontline doctors and nurses. The O2 work that Janet referred to. Early diagnosis gives patients a chance to get into good clinical pathways in which they get the things like oxygen when they need it, before they have deteriorated. We need safer environments in which doctors and nurses work. WHO has worked with the Techni Network, a network of engineering and architectural firms who on a pro bono basis have helped us to provide thousands of extra safer beds around the world. We have teams going everywhere in the world working directly on adapting existing facilities, looking at ventilation, looking at airflow, doing everything we can to make the healthcare environment as safe as possible for the patients and for the people who care for them. Because we believe our best asset right now are our health workers, our frontline health workers, 10 months in the front line fighting this disease. We need to look at how they're protected, how they're trained, how they're supported, how they're rested. There is no excuse right now to have health workers in the front line 10 months into a pandemic who don't have PPE, who don't have proper rest schedules and cycles of work, who don't have the support they need to do what they will have to do for some of our relatives and friends and others who may need their help in the coming weeks. So while we must focus on controlling this virus, we need to look at what we can do to save those who've already been exposed. I thank Janet, her teams all around the world. They are absolutely outstanding in what they've tried to deliver for patients everywhere, and never get a chance to thank you, Janet, but you know, well done, and to all of the people that work with you.
Thank you, Dr. Ryan. It's already more than an hour since we started this press conference. Before I close it, I would like to invite Director General Dr. Tedros for final comments. Dr. Tedros, please.
Yeah, so thank you so much to all colleagues who have joined here. And also thank you so much to journalists and others who have joined us online today. And see you in our next presser. Thank you. Thank you, Fadila. Shukran jazilan.
Shukran, DG. Just to remind journalists that we will be sending you the DG speech plus the audio file of this press conference. The full transcript will be available tomorrow on our website. I do apologize for